Hi, my name is Kimberly Morrison. I am in Nursing 725 and I will be presenting my pediatric history and physical exam. Today, 5-year-old Colt presents to the clinic with his maternal grandmother for a well-child visit to receive any needed immunizations and to discuss concerns about his eczema. His present illness history. Colt will be attending kindergarten and needs to have a physical form completed as well as a vision screening and a hearing screening. In regard to the concerns about Colt's eczema, his grandmother states that his eczema has been persistent, red, dry, and scaly rashes in the creases of his elbows and behind his knees for the past month. She's been treating his eczema with Aquaphor and hydrocortisone for about 1 year now, but for the past month, this treatment has not been working and it seems as though his eczema has worsened. She states that it seems worse after he plays outside in the yard and it is starting to bother him when he's sleeping. He complains that he is itchy. His past medical history includes current medications, hydrocortisone 1% topical ointment as needed. His birth history includes his mother had a healthy pregnancy. She received all prenatal care visits throughout her pregnancy. There were no use of any illicit drugs, consumption of alcohol, or smoke during pregnancy, and no illnesses or complications occurred. Her pregnancy was the only pregnancy. He was a term infant. He was delivered at 40 weeks, and his mother was in labor for about 10 hours. She had a spontaneous rupture of membranes, and there were no complications with the delivery. He weighed 7 pounds 7 ounces at birth. He also did go home with his parents after 48 hours of hospital stay, and there were no complications. He currently has no drug allergies or food allergies. There has been no history of accidents or injuries. Illnesses include otitis media at age 2, treated with amoxicillin. There has been no operative procedures and no hospitalizations. Colt is at his developmental milestone appropriate for age. He is able to run, skip, and jump. He can write his name, his phone number, and loves to draw pictures of his family on vacation. Colt tells me that his parents are deployed and he is living with his grandmother until they come home from deployment. He is able to dress himself and can tie his shoes. There are no issues with urinary continence during the day or night. His bowel movements are regular and no issues of constipation. He is up to date on all his vaccines. He received his last set of vaccines at age 4, DTaP, polio, MMR, and varicella. During that visit, he also received a auditory screening, which he passed right and left, and a vision screening with the LEA symbols 20/40, which is normal for his age. Family medical history. His mother is age 30 and in very good health. His father is age 32 and very good health. His maternal grandmother, age 55 and in good health. Maternal grandfather, age 56 and in good health. His paternal grandparents, grandmother is 57 and is in good health, and his grandfather is 57 and in good health. Screening for family medical history. His maternal grandmother has arthritis. His maternal grandfather has hyperlipidemia but is treated with medication. His paternal grandmother has hypothyroidism, treated with medication. And there have been no deaths within the first degree relatives. Family social history includes both parents are active duty military and currently deployed. They are married. His maternal grandmother is an elementary school teacher and is married. He's living with both his maternal grandparents because his parents are dual military and currently deployed. His mother will be returning home in 6 months and his father will be returning home in 9 months. He's the only living child in his grandparents' home. All utilities are functioning and he has his own room. There are no pets and there are no smokers in the home. Colt is living in a financially stable environment. His parents are caregivers. His parents and caregivers are working and have steady income. Colt has TRICARE standard for healthcare coverage. Colt has a close-knit family. He regularly FaceTimes with his parents and emails them. As a family, they take family trips to the beach and the mountains. He loves swimming in the ocean with his dad. His habits and personality. Diet. As he has a good appetite, eats 3 meals a day with snacks between lunch and dinner. Eats a variety of vegetables, fruits, dairy, grains, and meats. He drinks water, milk, and juice. He likes a variety of food, but does not like lima beans. Elimination. He has bowel movements at least once a day, moderate to large and soft. He has no difficulties with voiding or urinary incontinence. Exercise. He plays outside at least 1 hour a day and plays recreational soccer 3 times per week. He watches 1 to 2 hours of TV throughout the day and uses his iPad for 1 hour. He likes to read, build with his Legos, and usually spends 1 to 2 hours a day doing this. Sleeping habits. Colt's bedtime is 8 o'clock. He sleeps through the night and in his own bed. He sleeps about 10 hours a night. Personality and behavior. He's easygoing, has an easygoing temperament, and well-mannered. At times he is sad because both of his parents are deployed and he misses them. He is excited about starting school and meeting new friends. Review systems. General. Denies any recent weight gain or loss, fatigue, or lethargy. His skin. Red, itchy, scaly rashes on elbows and knees. His eyes. Denies any vision problems. Ears, nose, and throat. Denies symptoms of cold, sore throat, sneezing, stuffy nose, discharge, postnasal drip, mouth breathing, snoring, otitis, media, hearing deficit, adenitis, speech or language delay. Teeth. Primary teeth started erupting at age of 6 months. Cardiorespiratory. Denies any signs and symptoms or history of asthma, pneumonia, frequent URIs, difficulty breathing, chest pain, cough, sputum, wheezing, cyanosis, syncope, tachycardia, or any congenital heart defects and murmurs. Gastrointestinal. Denies episodes of diarrhea, vomiting, constipation, abdominal pain, or discomfort, jaundice, and reflux. Genitourinary. Denies enuresis, dysuria, increased frequency, polyuria, pyuria, or hematuria. Denies abnormalities of penis or testes. Neuromuscular. Denies episodes of headache, anxiety, fainting, convulsions, habit spasms, ataxia, muscle or joint pains. Denies postural deformity, scoliosis, feet problems, exercise intolerance, or unsteady gait. Pediatric physical assessment includes vital signs. Temperature 98.1, pulse rate 100, respirations 20, blood pressure 96/68. His weight is 42 pounds. He's in the 50th percentile. His height 43 inches, 50th percentile, and BMI is 16. He's in the 72nd percentile, which is considered healthy weight. General appearance. He's well groomed and appears healthy. He's sitting upright with good posture. He's calm and cooperative. His speech is clear and concise. 100% of his words are intelligible. His skin color is appropriate for race. Skin turgor is 3+ and moves easily. Skin is smooth and intact except for the anterior region of both elbows and posterior region of both knees. This area is red, dry, and scaly. Hair is well groomed and nails are clean, short, with no evidence of nail biting, discoloration, or disease. Lymphs. No swelling or signs of inflammation in his lymph nodes. His HEENT. His head is normocephalic. Scalp has no lesions and is non-tender. Face is symmetric. Neck has active range of motion with normal flexion, extension, lateral rotation, and tilting. Trachea is midline and mobile. His thyroid is palpable and normal in size. His sclera is white. Conjunctiva is pink. Pupil is reactive to light and accommodation. Corneal light reflex is present. Red reflex is present. Disc is round with sharp margins. Color is normal. There are no abnormal pigmentations, signs of hemorrhage, or exudate. Macula is visible, and there is no signs of strabismus. or photophobia. His ears are positioned symmetrically, size of pinna normal, canals are normal and free of wax, tympanic membranes are intact and translucent. There are no mastoid tenderness, and his hearing is intact. His nose is midline, he has pink mucosa, his nasal passage is patent, no discharge, and terminates are normal. His mouth and throat, he has pink lips in color, good dentition, no dental caries, no swelling or bleeding in gingiva. Tonsils are grade 1 with no signs of enlargement or infection. Uvula is midline and visible. Speech is clear and without odor. It's cardiorespiratory. His apical pulse, heart rate oscillated near the left mid-clavicular line in the fourth intercostal space. Pulse rate is 100. Rhythm is normal. S1 and S2 is auscultated and without the presence of a murmur. Radial and femoral pulses are palpated. Rate is consistent with apical beat and rhythm. His respiratory rate is 20 breaths per minute. His respirations are effortless with normal vesicular breath sounds. Contour of chest is symmetrical and with similar movement. There are no signs of retraction or wheezing. His abdomen is flat, soft, and has no CV tenderness. He has a flat umbilicus with no bulge or protrusion. There are no mass or enlarged lymph nodes. His liver and spleen are normal in size. His rectum is intact without hemorrhoids or fissures. He is circumcised. His meatus is midline, and he has bilateral descended testes. Musculoskeletal. His extremities exhibit active range of motion, normal tone. His color is appropriate for race and pink. Extremities are warm, no signs of clubbing or cyanosis, deformities, joint swelling, or tenderness. Has all 10 digits on his hands and feet. His spine, his posture is upright with a normal S curvature, active range of motion, no tenderness or tufts of hair. Neurological, he is age-appropriate behavior. He's alert and oriented to person, place, and time. His developmental stage is age-appropriate, communicates clearly and concise, knows his alphabet, can count to 100, and knows the color red, green, yellow, and blue. He writes his name. He can copy squares, triangles, and can draw a person with head, arms, legs, hands, and feet. All of his cranial nerves 1 through 9 are intact. His cerebral function, he's able to move his finger to his nose. He can follow my finger while rapidly alternating pronation and subnation of hands. He can stand with his eyes closed. He can walk and run heel to toe. And he has no signs of tremors, ataxia, unsteady gait, or posture. His arms swing and move freely. No signs of nystagmus, poor muscle tone, or speech abnormalities. His motor system, his muscle size, consistency, and tone are appropriate for his age. He has a steady gait, good muscular strength, and symmetric posture. He is able to provide resistance to passive movement and has voluntary movement. His sensory systems are all intact. There are no deficits in hearing or vision. He can feel light touch, pain, and vibration. His reflexes, deep tendon reflexes are intact. Superficial and pathological reflexes are intact. And there are no signs or symptoms of meningeal signs. This completes my pediatric history and physical exam. Thank you.